Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions to live your best life.
And today we'll continue our discussion from a few episodes ago on recent measles outbreaks, focused on Florida's response. But as always, we have a few news updates first.
Yeah, so the first thing I think we should discuss is Prescription Drug Advisory Boards, which is something that we had spoken about in the past. We did a special episode dedicated to it and its impact on patients. And in the last few weeks, we've had the opportunity to speak directly to some of these boards, one in Colorado and another in Oregon. And we essentially inserted the patient voice on these boards. And we'll talk more about this in the coming weeks as we continue to speak out on what these boards are doing and their potential impact for patients.
Yeah, and these are new. Like we talked about them a few episodes ago, did a deeper dive on exactly everything you need to know about it and what we know so far. So we're still, I guess, learning as we advocate. But the important thing is that we're getting the patient voice in front of these advisory boards.
Absolutely. And I'll just say anecdotally, without taking a deep dive on the subject right now, I had the opportunity to speak to the Colorado board, and I was very dismayed that the discussion amongst the board members for about an hour and a half, where I had a chance to speak, did not discuss much of the patient impact, and certainly did not discuss the affordability as it concerns patients themselves. I had prepared remarks ready to go, and I essentially, when it was my turn to speak, I said, I'm not even going to use my prepared remarks. I want to address what you guys are talking about and how you just have ignored patients in all of these discussions and deliberations. You've created straw individuals who are not actual patients. And the idea of pulling a stable patient off of medication has real world impacts that are not being taken into account. It was somewhat depressing, but also exhilarating, as we sometimes say. It is good to advocate. If for nothing else, there's a mental health boost to being able to speak up for yourself and for patients like you.
For sure. I'm glad you were there and able to bring in the patient voice. That's kind of scary that they were ignoring all those things at first when talking about medications that are for patients. It's so frustrating, right?
Yeah, totally frustrating. Totally frustrating.
Well, we do have a few more news items. So you had sent me this earlier this week and it really surprised me, but the Washington Post recently reported how tax records are revealing that 4 major nonprofits capitalized on COVID misinformation and profited off of it, which is like terrifying.
Yeah, it's amazing that there was an expose in the Washington Post that uncovered that there were 4 nonprofits, 2 of whom were really raking in the tens of millions of dollars between 2020 and 2022, tens of millions of dollars with high salaries to their executives and so forth. All of it tax deductible. And, so essentially with the, if you will, the endorsement of the U.S. government to be a nonprofit and spread misinformation about COVID. This is 2020, 2021. These are crucial times during the pandemic, and to spread dangerous information is hurtful, if nothing else, but to also be able to consider themselves a nonprofit, not pay taxes on their income is just horrific, to say the least.
Yeah, when you think about this, misinformation is putting people's lives at risk and damaging public health.
Totally.
And you're like profiting off of putting people's lives at risk. It's beyond terrifying.
Terrifying. Maybe we'll do a deeper dive on that as well in the coming weeks. There's a lot more coming to light about some of these nonprofits and what they were spreading. So maybe we'll put a pin on it there and maybe revisit it.
Sure. Our next bit of news, our colleague Robert authored a report with IQVIA, and they were looking at flu vaccines among Medicaid fee-for-service patients and the link between pharmacy reimbursement. And the goal was better to understand, what are vaccine rates compared to how pharmacists are compensated for giving vaccines. And they found that basically, so to quote one of the researchers, a $13 increase in pharmacy reimbursement for adult flu vaccination was associated with a nearly 6% point surge in the state vaccination rate for Medicaid fee-for-service covered adults. So basically what that's saying is that as pharmacists are reimbursed at a higher rate, the vaccination rate for Medicaid goes up, which obviously we want because we want people to get vaccinated.
Interesting. interesting. That's some interesting findings.
So currently, pharmacy reimbursement averages around $12 for this group, which is considerably lower than Medicare's $30. So it's interesting to see this stuff and how it could inform policy to help expand pharmacists' ability to vaccinate and get compensated for it.
Yeah. In other news, norovirus cases are surging in the United States, especially in the Northeast and Western states.
Yeah, I mean, this is nothing new. It's something that we've seen before and peaks during winter months. It is very contagious, so be careful out there. It's like a stomach flu that causes severe diarrhea and vomiting. There's no medication you could take for it, as far as I know, so it's really just taking care of yourself and hydrating.
All right. Well, I'll wash my hands. Wait, I already do wash my hands.
Sanitize those surfaces.
Oh my gosh. Well, speaking of viruses and surges, our southeasternmost state, Florida, is seeing measles and apparently not exactly mobilizing the most robust response to tamp it down. Let's get into that.
Yeah, we talked about this a few episodes ago, the rise in measles and just the history of it, like how it was eliminated from the US, why we're seeing cases now. Along with Florida, measles has been reported in 11 other states this year, which is kind of scary. You know, we're both vaccinated, so we're good. But when you hear of a disease that's been eliminated is now floating around, you have to wonder why.
Right. Well, the answer why is simple because you said we're vaccinated, but not everyone is.
Yeah.
So, let's talk about the response in Florida and why it may not be the most prudent, according to some public health experts. So the Florida Surgeon General, Joseph Ladapo, sent parents a letter granting them permission to send unvaccinated children to school amid the outbreak. Now, obviously, if you are unvaccinated, do not have the vaccine for measles, when there's a measles outbreak currently transpiring in your county, it's probably wise to stay home.
Yeah, and this completely contradicts guidance from CDC and just like well-established public health guidance that says if you're unvaccinated, stay home because of how contagious the measles is. So why are we seeing a response that says, oh, it's up to the parents to say whether the kids can go to school?
Right. And, the vaccine itself, by the way, is extremely safe. It's been around for a while. Listen to this stat from Kaiser Family Foundation. A person is four times as likely to die from being struck by lightning during their lifetime in the United States as to have a potentially life-threatening allergic reaction to the measles, mumps, and rubella vaccine.
Okay, we should almost have a video portion for this because jaws are dropped. Like, you're four times as likely to die by being struck by lightning than have a life-threatening reaction to the vaccine. That's like beyond shocking and just proves how safe it is.
Yeah. Anyway, the CDC reported that child immunization rates have hit a 10-year low. Last year, a record number of parents across the United States filed for exemptions from school vaccine requirements on religious or philosophical grounds.
Let's just pause for a second. I'm so curious to ask you, as a parent, what would you do if this was happening in your kid's school and you got a letter saying it's up to the parents to decide if the kids go in? Like, how would you feel if you were in this situation?
I don't know. You put me on the spot.
I know.
I mean, my kids are vaccinated, so I feel comforted. It's a strong vaccine. We talk about the COVID and flu vaccines, like, oh, they prevent hospitalizations and they tamp down the effects of the virus. The measles vaccine actually prevents the virus very strongly. I don't have the numbers in front of me, but it's a strong vaccine. I don't know the answer. Off the top of my head, I think I would do the basic things, call my pediatrician, what do you think? Call the principal, like, what the hell? Can we take a week off at least and see what's what? And ultimately, I probably would strongly considering pulling my kids for a week just to see how it goes, to see if it spreads more or to see if it's tamped down. But I don't know. That's off the top of my head. I don't know.
Isn't it also typically the local county health department or, more local public health figures that respond to these crises, not like the Surgeon General of the state?
I don't think it's unusual for it to come from the state health department, to be honest. But yeah, that's a good point. All right, we Googled it. Turns out that the Surgeon General of Florida is the title given to the head of the Florida State Health Department. Most states use the moniker commissioner. I don't know why they use a different moniker. That being said, it is a position when you head the health department, you're entrusted with public health, and you're doing something that seems to be in opposite of that mission by giving a permission structure for parents to send unvaccinated children into a place where measles may be present.
So let's take a look at what are like the vaccine rates for measles in Florida. Like, what are we even talking about here?
Okay.
So only about a quarter of Florida's counties had reached the 95% threshold, which communities are considered well protected against measles. according to most recent data from the Florida Health Department in 2022. And in Broward County, where 6 cases of measles have been reported over the past week, about 92% of children in kindergarten had received routine immunizations, and that remaining 8% is more than 1,500 kids who had vaccine exemptions. I know it sounds like a high number, 92%, but it's like a huge drop
Totally.
to go like below that threshold.
Right. That's a difference that allows for the spread, essentially.
Yeah, and we're seeing that.
Right, exactly. We're seeing that, and we're seeing it in the absence of any effort to curtail that spread. As best as I can tell, doesn't seem to be an effort to say, hey, there's X amount of cases. Let's stop it there. Let's not go beyond this, right?
For sure. I mean, like the reason we have public health guidance is so that in times like this, we can follow it. Like, I don't know why we're reinventing the rules and going against the science.
Everything's political.
And it's almost like we forgot the trauma of the pandemic we just went through. Like, we just went through COVID and quarantine and everything. And it's like so quickly people forget how, like precious our health is and how we really do need to stick to public health guidance in the face of these viruses.
Right. No, it's unfortunate to say the least. I mean, vaccine mandates have been used for measles. In 1991, Philadelphia's deputy health commissioner ordered children to get vaccinated against their parents' wishes during an outbreak. In 2019, there was a large measles outbreak among Orthodox Jewish communities in Brooklyn, and the New York City health commissioner mandated that anyone who lived, worked, or went to school in these neighborhoods get vaccinated or face a fine of $1,000.
And these were both for measles, but I mean, this is like a classic public health 101. I remember the first public health class we're talking about Jacobson v. Massachusetts, which was about smallpox, and the court upheld the state's authority to impose the vaccine because it put public health at risk, and public health was more important than individual rights in this case.
I was just going to go back to the standard moniker that we've spoken about before. Everyone has individual rights to do what they want, but you don't have a right to trample on my rights or others' rights. And causing a public health scare tramples on my rights. You have a right to drink as much as you want alcohol to your own body, but you don't have a right to get into a car and drive and put my life at danger due to that. So there are, public health laws exist for a reason. It's to protect the public health, if you will.
Especially our community who's immunocompromised may not have gotten all their shots because of their health, or, you have a weakened immune system. So the shot may not be as robust of a response in your body as it is for a classic healthy person. And that's why we get vaccinated, to protect each other.
Exactly. You have a right to do whatever you want, but there are public health. Like, you have a right to drive a car. You don't have a right to speed because you don't want to kill somebody or get into an accident with somebody else who's riding on that road. Laws exist for the betterment of society and enable us all to live our best lives, if you will.
And I guess one last note to leave this on, there are laws that we advocate for that reduce the ability for people to do these like philosophical and religious exemptions.
Right.
Just obviously like a medical exemption is a different story, but we do advocate at the state level. Many states have passed laws like this that help ensure that our communities are vaccinated.
Right. Like, for example, you shouldn't really be able to say, I don't want to get vaccinated because of the microchips that Bill Gates is putting in the vaccines and tracking me as a reason. Just an example.
Just a minor example there.
That's my favorite of the conspiracies, by the way, because if you ever look at a vial of vaccine before you get the shot.
Well, look at the needle. How would you, the needle is so tiny.
Yet somehow Bill Gates has invented a microchip that is smaller and can fit inside. Incredible. All right, well, let's talk about our learnings today. I guess I've learned that the more things change, the more they stay the same when it comes to vaccine hesitancy. And here we are, 2024, Florida, measles. And you, Zoe?
And my learning is just from the top of the episode about the Prescription Drug Advisory Boards, how important it is that we're showing up and sharing the patient voice there.
Yes, absolutely. We hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
And if you have any questions, comments, episode topics, email us at podcasts@ghlf.org. Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us that rating, write a review, and hit that subscribe button. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.